Hello, it is my honor to welcome you to today's timely, important, and impactful session on embedding equity in U.S. global health financing and diplomacy. I am so grateful on behalf of the University of Southern California and the Keck School of Medicine for our distinguished panelists who've taken time out of their busy schedule to gather here together. My name is Carolyn Meltzer. I'm Dean of the Keck School of Medicine of USC, and proud to be here. And I joined Keck recently to really because of its focus on health equity, on purpose-driven care for the communities we serve. And I'm very grateful to now have the opportunity to work at the same institution as the Institute on Inequalities in Global Health, a unique resource led by Professor Sophia Greskin, who you will hear from. USC is proud to provide this space where government and global health communities can get together to talk about how we embed equity into U.S. global health policy at what is a historic time. We certainly have a strong commitment to global health equity, but we also look toward events such as the rollback of Roe and the challenge, especially to reproductive rights and women's health, an area near and dear to our hearts. So we need to really take a more global approach to everybody contributing to these decisions and to really promoting health equity as it should be. So with that, I will hand things over to Professors Sophia Gruskin and Jonathan Cohen of the USC Institute on Inequalities in Global Health, and they will serve as your moderators for today's webinar.
Thank you, Dean Meltzer. Very much appreciated. I mean, today's dialogue is part of a series of events that we at the Institute on Inequalities in Global Health have been hosting that ask what it would look like for governments to make not only global health, but global health equity a priority in their foreign policy. And, you know, as you kind of noted, the question could not be more timely in the US, where, and I'm just going to give a few examples. The US president has committed to a whole of government approach to equity. The US Congress has just been asked for a 6-year, $3 billion replenishment pledge to the Global Fund to fight AIDS, TB, and malaria. And as you indicated, the US Supreme Court has narrowed the space for gender equity and health by overturning the constitutional right to abortion care previously guaranteed by Roe, something we at IIGH are super focused on these days. And with that, Jonathan, over to you.
Thank you so much, Sophia. Thank you, everyone. Apologies for my laryngitis. Sophia, really thank you for that introduction. Those are examples from all three branches of the U.S. government, the executive, Congress, the judiciary, all seized by the issue of global health equity as we speak. We are incredibly fortunate to have two of those branches of government represented today, the Congress and the executive branch. Dean Meltzer, I want to thank you for your introduction too. And speaking of which, to frame this discussion, we have the immense privilege of introducing Congresswoman Barbara Lee, whose leadership in global health from the US Congress is simply unrivaled. Congresswoman Lee has been representing California's 13th district since 1998. She is the highest ranking African-American woman in Democratic leadership. She also, of course, serves on the Budget Committee and the powerful Appropriations Committee, which oversees all federal government spending. Among her countless accomplishments as a legislator, Congresswoman Lee has been a fierce advocate for ending HIV and ensuring an AIDS-free generation. Since entering the U.S. Congress, she has authored or co-authored every major piece of HIV/AIDS legislation, including the legislative frameworks for the President's Emergency Plan for AIDS Relief and the Global Fund to fight AIDS, TB, and malaria. And in January of 2021, Congresswoman Lee became the first African American to chair the House Appropriations Subcommittee on State Foreign Operations and related programs, which cements her major historic leadership role in global health and global health equity. And we're going to queue up a message from her now.
Thank you so much for that kind introduction, Professor Cohen, and to the University of Southern California leadership for inviting me to speak today and for hosting this very important discussion. There is no doubt that the COVID-19 pandemic has been a crisis of historic proportions, with more than 1 million deaths this year alone in the United States, coupled with the Biden administration's commitment to equity across the U.S. government. We must support equitable health care globally by delivering COVID vaccines in Africa and around the world. Until we are all vaccinated, we will continue to face the possibility of future and more deadly variants. Today's dialogue will bring us closer to that goal and to the goal of ending all treatable disease. Millions of people around the world die each year from preventable illness. While we've made great strides against them over the past 2 decades, access to life-saving tools and treatments has been profoundly unequal. For example, 10 million people living with HIV, primarily in Africa, still lack access to antiretroviral treatment. Groups such as LGBTQ people, young women and girls, and other marginalized groups disproportionately bear the impact of these diseases. To tackle these inequities rooted in systemic racism, we need to continue to invest in what works. We also need to be bolder about addressing stigma and give people the tools that they need to protect their health. We need to stop assuming that we know best about what people want or need, especially in other countries, and allow them to have a voice in their own health. For example, we could do a much better job of supporting regional institutions like the Africa Centers for Disease Control that are governed by people accountable to those receiving services. We need to work in partnership with all countries at all income levels to encourage global investment in equitable healthcare, which is, quite frankly, as you know, a human right. I was proud to work with my colleagues when I was first elected to Congress to establish both PEPFAR and the Global Fund to fight AIDS, tuberculosis, and malaria. Every American should be proud of the contributions the United States has made through these 2 initiatives to the health and well-being of millions. And it wasn't easy, but we kept them as bipartisan efforts. For over 20 years, the Global Fund has provided a proven and tested model for effectively fighting epidemics, saving 44 million lives while putting human rights and equity front and center. And I am so proud that our state foreign operations and related programs bill for fiscal 2023, which includes $2 billion for the Global Fund as the first installment of a 3-year pledge. And I'm so proud to be the chair of this subcommittee on appropriations. At the 7th Replenishment Conference last month, other donors helped meet this moment and do their part to establish better equity and security for tomorrow, but we still have a long way to go. I know the work we've done here in the House of Representatives helped galvanize other donors and put the Global Fund on track to reach our $18 billion investment goal. Yes, as I said, we have so much more to do, but we're going to continue to work. And you know, as I chair the subcommittee on approps, we're going to use our platform to do this. More and more people, including an inspiring new generation of students and practitioners here in the United States and in my home state of California, are calling on us to decolonize the field of global health as part of our broader commitment to racial equity. Again, this is a priority in my subcommittee. What does it mean to decolonize global health? For me, it means simply that there is no distinction between global health and Americans' health. We all live on the same endangered planet, and it would be a grave mistake to define global health as the health of people over there or in other countries. Thank you so much to the Institute on Inequalities and Global Health at the University of Southern California for bringing us together. I'm calling on you to be bold in your discussions and to develop transformational solutions. And again, I'm going to remind everybody to get politically involved and vote. Thank you again.
Thank you, Congresswoman Lee. We're certainly off to a powerful start with that. And we've heard about COVID vaccine inequities, about the Global Fund, about the decolonization of the field of global health, and so much more. It's hard to kind of wrap my head around everything that we just heard in the last couple of minutes. And we just could not ask for a better panel of leaders to be in dialogue with one another about the issues that the Congresswoman put on the table. Y'all, if it's okay with you, we'd like to introduce you all at once and then put the questions to the entire panel. And Jonathan and I are going to do a little duet here. We're going to kind of go back and forth. So Lois Pace, who is the Assistant Secretary for Global Affairs for the U.S. Department of Health and Human Services, where she is responsible for advancing the U.S. international health agenda through multilateral and bilateral fora. She reports directly to the Secretary of Health and Human Services. She is the Office of Global Affairs lead on setting priorities and policies that promote U.S. public health agencies and interests worldwide. She oversees HHS's engagement with foreign governments, with international institutions, as well as policymaking bodies, including the G7, the G20, the UN General Assembly, and the World Health Assembly. And previously, she served as president and executive director of the Global Health Council. She was a member of the Biden-Harris Transition COVID-19 Advisory Board. And before that, she spent over a decade working with community-based organizations and grassroots leaders in countries across the African continent and around Asia on campaigns calling for person-centered access to health. It's a pleasure to have you with us.
Thank you, Sophia.
I have the pleasure of introducing Pascal Alote. Pascal is the director of the World Health Organization's Department of Sexual and Reproductive Health and Research, which includes WHO's Human Reproduction Program, and she is a globally recognized expert in sexual and reproductive health rights. She most recently served as director of the United Nations University's International Institute for Global Health in Malaysia. She brings over 3 decades of experience as a global health researcher with work across 4 continents. Her work has covered health equity, health and human rights, gender and the social determinants of health, forced migration and marginalization, infectious diseases, and non-communicable diseases. She has held numerous leadership and academic roles and has been recognized for her early work in anthropology and gender, which provided critical evidence contributing to women receiving protective bed nets. Pascal, it is such a pleasure to have you here in dialogue about embedding equity into U.S. global health financing and diplomacy. Back to Sophia.
Thank you, Jonathan.
And yeah, and then we have Alan Maleche, who is an amazing leader. He's an advocate of the High Court of Kenya. He's a human rights defender with over 15 years experience in law, ethics, governance, policy, health, and rights. He has 8 years managing rights-based programs that protect affected, marginalized, and vulnerable populations. And he currently serves as the executive director of Kenya Legal and Ethical Issues Network on HIV and AIDS, Kellen. He sits on and he co-chairs the UNAIDS Human Rights Reference Group, and he's a member of the International Advisory Board for the Global Health Center. He is a former board member of the Developing Country NGO Delegation to the Global Fund Board, where he also served as a member of the Global Fund's Audit and Finance Committee. He formerly chaired the Implementers Group of the Global Fund Board, and he has been awarded many prizes for his leadership and dynamism in this global health space. So again, an amazing panel. Alan, thank you for being here. Thank you all.
Thank you for having me.
A pleasure, a total pleasure. Let me kick this off. I mean, equity means a lot of things, as Congresswoman Lee really alluded to. And as we know from your work, let me ask each of you briefly, what definition of equity do you operate under when you're doing global health work? Lois Pace, may I start with you on that?
Yeah, of course. I think you all alluded to what the administration put in place early on in the president's tenure. There's an executive order that was signed the president's first day in office, in fact, and really outlines what we mean by equity. And essentially it's really looking to correct what has been sort of the unfair, undue treatment or unjust treatment of individuals who have been left behind, right? And what we're trying to do is to flip it so that there is a consistent, systematic, fair and just, impartial treatment of individuals, communities that belong to these populations that are historically underserved or marginalized. And we call them out, right? We talk about Black and Latinx populations, we talk about indigenous groups, we talk about Asian Americans, Pacific Islanders, Hawaiians being a part of that important community. But this is using a domestic lens and really mindful that it's not just about race and ethnicity, it's about people who live in poverty or experience poverty. It's about obviously the spectrum of gender diversity and the need to achieve equity in that realm as well. So it's broad, and we're thinking globally. Obviously, just going back to what we were doing on day one, responding to the COVID pandemic globally, it's about geography and ensuring that we are closing those gaps across, again, important communities, but also countries around the world. So that, to me and to us, is how we approach this issue. We claim it, but we also name it outright. And, you know, those examples are not meant to be all-inclusive either, because there are a number of ways that we can and should be approaching the equity challenge and our obligation. And I think that, you know, just as another point of reflection, you know, it's really important to us also that we're not kind of intimidated or overwhelmed by the work of equity. You know, it sounds like a lot, and I think a criticism that we collectively hear in this space is, well, there's too much to do, and if you're including everyone, how can you tackle it all? And the fact is, well, you know, how can we not, right? Like, how can we say we're about doing this work and leaving no one behind without turning over all these stones and ensuring that we're seeing and shining a light on everyone who deserves that level of attention. So as the Congresswoman said, you know, health is a right, and it's a right for everyone. And so we are just going to continue to work in that fashion and in pursuit of that goal.
Great, thank you. I super hear you. I guess, Pascal, let me turn to you. What are your thoughts on this question? Let's get them all out there.
Can I start, please, first with a bit of a caveat? This dialogue is clearly really important, and we recognized it a while ago. And in your introduction to me, you mentioned UNUIGH, the United Nations University, and also mentioned that I'm with WHO. I do want to stress that my interventions here are my own and do not necessarily represent the views of either UNU or WHO. And secondly, given this notion of representation, my comments draw on my learning and experience of being a Ghanaian, a woman from relative privilege, and this has enabled me to travel the world and gain exposure to a variety of institutions and communities. But also of note is the experience of being very much the minority in many of these spaces, with all of the baggage that comes with that. And also, I cannot pretend to be a voice of Africa or of low and middle income countries or the catch-all global South. So having said all of that, I guess the textbook response refers to global equity as the absence of unfair, avoidable, or remediable differences in health among population groups. And the Commission for Social Determinants of Health brings this down to social, economic, demographic, geographic characteristics. And within the context of global health, this provides the opportunity to define good measurable indicators of equity. But what these leave out, which I think is critical, are the underpinning values inherent in equity. The values that recognize the unfairness, the injustice, and sometimes the need for reparations and redress and recompense and remorse and restitution, all ours. But I think this happens for several reasons, but I'll only mention two that I think are critical to the way that I think about this work. So within the context of health, we are very poorly equipped to work outside the constrained boxes of the measurable. So we focus on proxy shortcuts. So even when we identify and articulate very clearly the causes of the causes that relate to racism, to stigmatization, and institutions that are structured in oppressive colonial histories, the only thing we know how to do is to fix what we can see. So we focus on the disease and maybe fix access or fix the cost, but we fail to work through the most challenging questions of how to produce health. The other challenge is how to operationalize the definition of equity. And I think it's in the ideological nature of values. Inequity comes with the maldistribution of power, and to equalize, there has to be a preparedness to share, which means giving something up. And for those with a sense of entitlement, this becomes an almost unconscious bias in being able to address equity. And then finally, to extend this discussion to global health, I'll flag that in spite of us being getting bogged down in definitional issues, the two broad levels of engagement within global health, and specifically because this context is about the US, I'd like to highlight the issue of engagement within what health equity means within the multilateral and bilateral space. The second is in this notion of global health as it relates, as Lois says, to health unrelated to national borders, the COVID-19 example, for instance, being one area to think about, another being, for instance, the health impacts of climate change. And addressing equity in the context of the first is tightly bound with multiple agendas that relate to the complexities of foreign policy, well above my grade, as well as national commitments to global citizenship and the development agenda. And when these are mutually reinforcing, we're in good shape. The biggest challenges here arise, however, in the implementation and in questions of respectful and equitable engagement, in the mechanisms through which the flow of financing in particular can avoid perpetuating the donor-recipient and the power imbalance neo-colonial relationships, again, that have been alluded to. And then secondly, equity in global health, as in health beyond borders, has been starkly illustrated by the pandemic, which is yesterday's news for many, but still a critical injustice for large parts of the world. So data from 2 days ago states that almost 5 billion people so far have been fully vaccinated. And to make the inequities real, 27.3% of the target population of Ghana, for instance, have had their vaccinations. In Guinea, it's 22.6%, Equatorial Guinea, 15.3%, Gabon, 11.6%, all G countries, compared to 68.6% in the US. And I acknowledge that these are national averages and mask significant inequities within the countries, as well as across countries. But that is exactly the point, that there are tough decisions to be made that need to be explicit and manage the expectations of a global solidarity and equity on one hand, balanced against national priorities for global health crises. And I think this should be one of the things that we try to address in this discussion. Thank you.
So much to chew on there, I gotta say. All right, Alan, how about you?
I think I feel extremely disadvantaged having to go after very smart ladies who have nailed all the points, but I'll try my best to stay in the competition. I'll start off by saying that 3 words stand out for me when I look at issues of equity, particularly in the lens of global health: impartiality, fairness, and justice. And so how I approach this conversation alongside community colleagues, alongside civil society colleagues, is the decisions we make, whether it's in Geneva, whether it's in DC, whether it's in New York, how are they fair? How are they impartial? And how do they take into account the issue of justice? So the issue of justice, to the sense that there are certain things that have happened that have disadvantaged certain populations and made them more vulnerable. How well are the decisions we are taking to fund them, to support them, going towards addressing that injustice, and not just as a one-off issue, but more of a sustainable issue? How are we making decisions based on evidence that are fair, not driven by political divides, not driven by racial divides, not driven by geographical divides? How do we realize and attain decisions that are fair, evidence-based, and take into account the needs of the affected communities? And how impartial are we in that decision-making process? How sure are we that our hands are not behind our backs, tying other deals while we are making those decisions because A, our country is likely to benefit or my people are likely to benefit? So I look at global health as you as an individual, as a representative of civil society, as a member of affected community, being able to get into a space and helping to drive the conversation to bring those three aspects out. And not only to look at global health equity, but also to look at equity at the national level, because at the end of the day, we retreat back to our national countries, where our countries have legal and constitutional obligations to realize our right to health. And so, how is this playing at a global level? How is this playing at a national level? But most importantly, is the information and experiences from those who are most affected trickling to the table where the decisions are being made, and are the people actually on the table to explain that experience and to provide solutions? So from a civil society perspective, it's getting on the table, being supported to be on the table, being allowed to voice, and being able to fairly and equitably speak about the issues that can then drive the change. I do hope as we go on, we will have more time to be able to see how practically that can work. And I do believe the US government does hold the key to make that a possibility.
Thank you. Thank you, Alan. Thank you, all of you. And truly, I think the three of you are constructing jointly an incredibly robust vision of what equity looks like in global health, encompassing, of course, the correction of unfairness and undue historical exclusion, the closing of geographic gaps defined by poverty, the inherent recognition of historic injustice and unfairness, fixing not only what we see, but what produces what we see, the preparedness to share, right? Operationalizing this through foreign policy being aligned with the development agenda, and financial flows being equitable rather than reproducing colonial hierarchies, making decisions in capitals that are based on fairness, impartiality, and justice, and taking into account the needs of communities. We have hundreds of listeners today. Many of them are students at the University of Southern California, who I think are benefiting from an incredibly robust definition of what equity looks like in global health. I want to turn to questions of strategy. I want to ask you all, and we're going to begin with Pascal, what you think are the most effective levers, leverage points that you have at your disposal. And Pascal, I acknowledge you're speaking in your individual capacity to advance this definition of equity. And if I may, what recommendations do you have for each other? You each represent different either branches of government, community systems, the multilateral systems. What recommendations do you have for each other for advancing global health equity from your respective sectors? Pascal, let's begin with you.
Thank you again for that. I mean, I think in some ways the answer is simple, but also incredibly complex. I mean, I think we need to extend the range of voices with whom we engage, and privilege the knowledge that we gain from a wider variety of voices. And I guess very specifically for us, even though I say I don't represent the WHO, the work that we're trying to start now in terms of trying to develop a global strategy for sexual and reproductive health is engaging in a very consultative process that allows us to listen and listen to the right voices or a greater diversity of voices that allows us to be true to what it is we're expecting to achieve by the end of the process. We can't solve these issues through these sorts of dialogues. They're incredible examples of resilience and innovation. There was an amazing program, for instance, if I can tell a little story, an amazing program set up by a woman in Malawi, and this was a few years ago. She came from a different tribal group and was brought into a community through marriage, and then was widowed, and ended up setting up a shelter for abused women in the community. By the time she had set this up and it was accepted in the community, she moved all of the men out of the village. The men were not allowed to come into the village, and she set up what became a self-sustaining community within the district, with the women totally responsible for farming, for marketing, for everything. They linked up with the district health services, and they now trained, and they've produced community health workers and so on. So it was a community-led project on violence against women, but it became a catalyst for change and for development. It's a great story in and of itself, but there is so much more that we can learn if we privilege what these sorts of examples give us. So what was the formula to make that work? What were the factors from there that are transferable across contexts or scalable? Programs like that often then tend to attract funding, and there are many pockets of success which breed more success, but at a structural level, these changes do not become sustained if we don't work with governments towards systemic change. Too many of these efforts do certainly make a significant difference to people's lives, but they're not sustained if we are looking for societal transformation. They are not sustained if they are not backed by national level policies. So we do need to find ways of engaging respectfully at the government level as well. Now, related to that, we need a better ways of compiling this sort of evidence, analyzing it, and using it to inform cumulative learning, and genuinely finding ways of amplifying this sort of evidence that is driven from multiple sectors. We need to engage more with foresight approaches that allow us to bring together the complexities of the issues that need to be addressed within the context of equity. And so undertaking a gender equity analysis, and I will obviously keep referring to gender equity assessment of policies, programs, and interventions can be incredibly effective. And to use a recent example, for instance, and given where COVID is clearly important, a colleague and friend of mine, Mina Schwalbe, used a gender assessment tool developed by the UNU Institute for Global Health, where I was formerly, and UN Women, to systematically identify the potential gender-related inequities in the US delivery of COVID vaccines to several African countries, in several countries in sub-Saharan Africa, which means that it provided an opportunity not just to do it locally, but also to think about how that through, whether it's through capacity building or through the way in which the US engaged with countries in that COVID vaccination distribution process, provides an opportunity as well to embed the issues or the questions around equity within that as a program. And while I did say I'm not representing WHO, I do want to give a shout out to the Director General's new initiative on health and peace, which I think might be particularly of interest to you, Alan. And I was at a meeting this afternoon, not at WHO, where some of the issues discussed related to gender inequities in conflict. And the go-to is always examples around sexual violence and so on. But there are a real swathe of issues that were raised that included the trafficking of women, sexual violence as a tool of war and so on. And again, opportunities to explicitly undertake an analysis that will allow us to anticipate these issues will obviously be critical in how to engage globally and within and across our engagements with government and so on for sustainable change. Thank you.
Thanks so much, Pascal. And want to also acknowledge that Nina Schwalbe, who you mentioned, is here in the audience. She's put in a really important question, which I want to invite you to incorporate into your responses if you have the opportunity, which is this question of if you could make a change to the existing system to incorporate equity, what would that change be? So I invite you to speak to that. And on this question of strategic levers that you have and that you see others having and recommendations, let me go to you, Alan, next to pick up on that.
Thanks. So I think in the context of speaking about the US government, I see many levers there. Lois, the Assistant Secretary, is a good friend, and I'm not just saying that because she's a friend, but the levers are real. Who is the biggest donor to the Global Fund? Who is putting most money on the table for WHO? Who is funding PEPFAR? Who is funding USAID and the initiatives that are covering the country? So I see the funding by the US government as a leverage, and I don't see the funding in a silo. And my first recommendation based on that is how do we try to get the US government to align its funding not only in the health sector but across its other sectors? They may fund work on rule of law, they may fund work on trade. How do we get that funding to walk the talk of equity based on the president's executive order? I think that's a very important leverage. We cannot downplay the influence, the power, the financial might that the US has and how it can be put to good use. We have already experienced what happens when it's not put to good use, and so we do not want to go back there. And so we want to see how could that play in and how well can this happen, because in civil society we are calling for working outside of our silos, working within movements, but is it also possible to see the funding that is galvanized from the US and which is indeed important? 6 billion to the global fund is not a mean feat. It's actually something that is critical, and some of that funding goes directly to communities and civil society. So how do we use that leverage, and how do we organize and influence how that funding works at the global level, but as I mentioned, also at the national level, because there are entities that fund malaria work, there are entities that fund TB work, there are entities that fund HIV work. How do we take that conversation forward? And that is definitely something, if well worked out, and referring to Representative Barbara Lee, if we use that money to fund the things that work, and we do have the evidence on the things that work. We know funding human rights work works. We know that incorporating social aspects towards medical responses work. We know that putting the power and education in the hands of community to collect data and to hold their governments accountable works. How do we design that funding to get to fund the right people and what works? So that's one important lever that I'd like us to take into account. But most importantly, we are dealing with a live issue of a pandemic treaty. And we are looking at it as an opportunity where the world and countries can pronounce themselves around what is their stand on dealing with the inequity that has been exhibited during the COVID response and other pandemics that are likely to come up. And so this becomes another important lever where we do hope that the US government would be in a position to not only drive the conversation but open the door, increase the number of chairs on the table, and allow civil society to have meaningful participation in the conversations. It has not been easy in terms of doing so, but I think there's more room to be able to do so. And linked to that, there's actually an intermediary fund created at the World Bank, which we acknowledge has got 2 seats for civil society, but will that fund actually do what is meant to do, or will it be another DC decision that doesn't relate with the reality? And most importantly for me, and also linked to, I know Pascal is not speaking on behalf of WHO, is to also appreciate the momentum that's going on in the WHO of trying to look at things beyond a medical approach and looking at it from a holistic perspective. What role does gender play? What role does equity play? What role does human rights play? And I think having WHO members being able to drive that conversation, but also having the willingness of WHO Secretariat to take up the conversation beyond a medical approach to issues is extremely important. I want to finalize by saying, and quite importantly, is we must not forget the harm that is coming through from various players in the industry. It could be the food industry that is marketing unhealthy food to children in low middle income countries because the laws have restricted them elsewhere. Or it could be big tech companies that are running smoothly in low middle income countries and are causing some form of harms, including in sexual reproductive health, and yet are not being held accountable either by Congress or the judiciary. How do we ensure that those who are major players in the US spaces are not replicating some of the harms at the low middle income country levels? And how could we collaborate both with multinational agencies, with government agencies in the US, with civil society, to be able to minimize this harm and make our world a more healthy environment? So I'll pause there, and knowing that we'll have another chance to come back and share more thoughts and levers. Over.
Thank you. Thank you so much, Alan. And indeed, comments are coming in. Our colleague Coral Andrews writes to all of you, thank you for your rich and strategic discussion on equity and diplomacy. The role of champions and leaders is essential, as you've all highlighted. More comments are coming in. Alan, you mentioned the pandemic treaty. Of course, the president has just appointed a lead negotiator for this. Perfect opportunity for the negotiating position to reflect the values you mentioned, and perfect segue to you, Assistant Secretary Pace.
That is a really great segue. Yes, we are very excited to have Ambassador Hamamoto come on board. She'll be leading a team across the U.S. government, across our Department of Health and Department of State to advance that agenda. And it's something I know I'm looking forward to working with her on. But I'm going to try to pull on some threads that others have left for me. And Alan, I appreciate you evoking me a couple of times in my official capacity. And you're right. I mean, there's a lot of power that we wield, right, as an entity still. And I think it's been my intention that we use our power for good. And so ideally that has come through in the COVID summits that the president has convened, right, and purposely convening those or co-convening those with other countries, including South Africa and Indonesia. Ideally, it's also coming through in how we show up for conversations about the financial intermediary fund and pressing ourselves, right, pressing others around that table to ensure that this is something in which low and middle income countries feel included, in which civil society feels included. And I agree. We're still at the beginning of that process, and that door needs to be opened even wider than it has been. But it is our great intention, not just hope, but our core objective for the work that we do, especially moving forward, to reflect that core principle. And it's something that I think the Congresswoman and Pascal were both speaking to earlier as well as I see it coming in as comments, which is, this is not just about closing gaps, as I talked about earlier, right? And what these individuals or communities receive or get from programs that are more fair and just and equitable, but it's a matter of what they give as well and what opportunity they have to contribute to that change themselves. So this focus on engagement is just so critically important, and I'm really glad that this conversation feels balanced in that regard. So thank you to others who lifted that up before I came back in. I also want to acknowledge as well, you asked about levers, Jonathan, and if I think about sort of the nodes of power, for better or worse, right? There's still a lot that someone like me or someone like my boss, the secretary, can do in a G7 or G20 forum, right? there's a lot that we can do at WHO where this pandemic accord or agreement is being negotiated. And we have to be mindful of that, not just in terms of, as Alan was saying, looking across the health spectrum, but also acknowledging the important intersections and the role that equity can play as a cross-cutting issue. We've heard that with regards to COVID-19 and, for example, technology transfer and the ways that our NIH has been able to contribute in that space. We also have a new Office of Climate and Health at the Department of Health, because that we are acknowledging, look, these two really important issues can and should come together in critical ways. And then obviously, when we think about health as a right, whether we're talking about sexual or reproductive health and rights, or more broadly, universal health, really finding that synergy and working across these spaces is something that I think that government can be pushed more to do. And so I guess I will land or end there, which is, Jonathan, I think you also asked, well, what would you call on others to do to push you? Or even Nina was asking this question as well, if you could change one thing. And I think I would encourage stakeholders to continue challenging that status quo. Like Pascal was saying, it feels very basic. But in reality, I think when I'm part of conversations and trying to just turn the cube around so that people see a different part of that, there's still a question I get, which is, well, how do we know that will work? And what will we do if that completely changes? You think of something like the Global Fund, which has been so successful over decades, in which the US has proudly contributed. And yet, I think, those institutions and the global health architecture overall is seen as so sacred that it's really hard for people to imagine something different, right? And it doesn't mean those institutions or activities go away. It means they evolve for the better. And I think, again, our role as members of that board or just participants in this process really needs to be pushing that envelope. And it has to feel safe to challenge core assumptions, to push us away from the status quo in a way that, I think a lot of us still struggle with. And so that would be my hope, is that we in government and elsewhere, the donor community and otherwise, receive just that much more pressure to think differently and be okay taking those types of steps. Now, that also means that, constituents are going to have to come with solutions, right? Or ideas for what alternatives could be. But let's have that conversation, because I worry about the default, especially given the sense of urgency people still feel to respond to crises like COVID or Ebola or cholera, or to sustain momentum in this space.
This is such a rich conversation. I mean, honestly, there are so many threads that I think we all want to start pulling together, and I'm really conscious of the time. Let me try to sharpen us a little bit and to say, all right, let's come back to this moment of opportunity that we're now in, all right? What is, for each of you, the one immediate opportunity that you see to be able to embed equity in US global health policy and diplomacy? And let me just go a little bit, drill down just a little bit more. When you think about US global health policy and diplomacy, how can it better embed and reflect gender equity and sexual and reproductive health and rights now during this time where in the US, there's this increasing narrowing of space for reproductive choice? So let me ask each of you for a brief response. Alan, can I start with you this time?
Great. Being a student currently in the US, I think every week there's a panel on DOBS. So I think I will start off with that and say we should have gotten someone from the judiciary on this bench so that we could have a cross conversation. But I think let me say the closing down of space, not only for sexual reproductive health, but also civil society, especially LGBTQI and people living with HIV in certain countries is a worrying situation, and something that I hope could be weaved into the diplomacy conversations that the US government has with various governments. And that's why I was saying, if you only approach it from a health perspective, you're likely to miss the boat. You need to find out what are your colleagues who work on rule of law, what are your colleagues who work on democracy or who fund work on that are doing, to be able to weave the conversation into it. But to be more specific to the current and very distressing situation about reproductive health status in the US and also globally, is one to say that it, and I believe Secretary Blinken has already done it, coming out clearly to say it is not the current US government's policy to limit funding for sexual reproductive health. Let people not get the misconception that the position of the Supreme Court is a foreign policy position of the US government, because we have seen bandits and others who profess to be holier than thou jumping on that bandwagon to try and drive a conversation in country to say, but the US does not support abortion anymore, so why should we support it? But luckily for some of us, we do have strong constitutions, we do have strong health laws, and we do have strong judiciaries, as demonstrated by India just a few weeks ago, by passing decisions to say that indeed women have a right to make a choice and women have a right to have access to reproductive services. So the one thing around this reproductive health issue that is really urgent and important is to ensure the right messaging goes out, but not only the right messaging, that actual funding does follow that messaging, and we don't see any cutbacks, we don't see any pushbacks from the country teams and the country offices. And also linked to the agencies that work on this issue, could be WHO, could be UNFPA, could be UNAIDS. We need to see them also continuing to speak up boldly and guiding countries, because countries dearly rely on the guidance from WHO, from where I come from. So how do we ensure we are getting them to think through about supporting reproductive healthcare work and moving things forward? And definitely within the US, I think the time now to mobilize, the time to convene, the time to work outside the silos of SRHR, it's now or never. Beyond voting and getting good congressmen and women on board, we definitely want to see, would the Dobbs moment be a moment that ignites the civil society in the US to come together one more time and really prove to the world that we can take this battle and we can change the situation, both in the US but also globally, because again, the US remains a global leader on a number of things, and sexual reproductive health is one of them.
Thank you. Thanks for that. Assistant Secretary, over to you.
Well, I think I can co-sign a lot, if not all, of what Alan said, and what I know Pascal will say about that issue in particular. Secretary Becerra and our Department of Health has been quite vocal and out front on this issue, not just domestically but globally, and so it's nice to know that's being heard and felt. I also want to take your question, Sophia, and really just focus on the importance of addressing gender and all its diversity, and ensure that we are using this moment also to promote those rights and the risk to those rights around the world. And so alongside the fallout of the Dobbs decision and, trends or tendencies worldwide to shift in a direction we don't want to see, right, when it comes to SRHR, there are also sort of aspirations to have that bleed into the rights of LGBTQI individuals and communities in particular. And so I think many people were even tracking events at World Health Assembly this year, where sort of in an unprecedented fashion, it really was brought into focus there in a way that we never would have anticipated or wanted to see. And it was really important for the US to speak up alongside other governments and say, look, this is unacceptable. And we have to absolutely keep doing that. Unfortunately, I think it's a defensive and offensive strategy where we have to be reactive, but also need to really look at opportunities to ensure the world knows where we stand on these policies. But that's I think one area where I want to be sure we're standing up and speaking out.
Super hear you. Thank you. Thank you. Pascal, go for it.
So I think, in fact, the resistant presents an opportunity. I mean, being a glass half full person, I think a good interpretation of the strength of the resistance to gender equality and to sexual and reproductive health and rights is that these are issues that matter deeply, whether they're seen as a threat or as an opportunity. And that says something, and we need to listen and to learn. If we don't, those who are better skilled at the messaging will be responsible for decisions that will have a rippling effect for generations. So if we can't wave the banner that says feminist in the house, let's find other entry points. I mean, if you held a meeting on gender equity, pounds to pennies, it's clear which countries will be represented. We are very good and very protective of our echo chambers, but we need to get out there. So I guess my one opportunity will be to say we need to be bolder about looking for different spaces. The digital revolution, for instance, and digitization is a space that will bring more people to a table than gender equity, unfortunately. And the good thing is that we have started collecting the data and doing the analysis of the opportunities and risks in that space. So how do we use opportunities like that? And how do we use those to innovate, to promote gender equity and to promote the messaging that is very clearly that ultimately we all do have the same outcome, which is that I don't think there's anybody who will say that they don't want healthy women, or they don't want their son or their daughter to be healthy. So I think we need to be bolder. I think we need to be a bit more out there in people's faces, in different spaces, and really push the messaging through different areas.
Thank you. Thank you all. So this hour has flown. We are just under 5 minutes. I'm going to invite each of you to make a brief concluding comment before Sophia concludes the event. Before I do, I want to acknowledge the caliber of comments and recommendations that are coming from our audience today. I'm going to read some of them. I'm going to invite you to react to them in your brief concluding comment if you wish, but really incredible suggestions, that we prioritize human rights for marginalized groups in the upcoming White House Africa Leaders Summit from Asia Russell at HealthGap, that we incorporate equity into the forthcoming national security strategy from Coral Andrews, that we make sure that money from the Financial Intermediary Fund reach the frontline groups and not just the major U.S. contractors from Meg Davis, that we relax visa requirements to facilitate meaningful participation from the Global South, from Nerima Were. So with that, let me invite each of you, starting with Assistant Secretary Pace, to just offer a brief concluding remark with our deep gratitude.
Well, the gratitude is mine, frankly. I was going to just say, Jonathan, looking at some of these comments, that it is encouraging to already have this level of engagement with the community, which I know has always been there. And frankly, I know I and my team have benefited from. So please do keep this coming. Some of this we're doing, right? So I'm happy to be able to say that. But these additional ideas are really helpful as we move forward and ensure we're doing right by people, again, who need us to do right by them. Thanks.
Thank you. Alan.
Thanks. I think those are great questions, and indeed acknowledge the African Leaders Summit being a very important opportunity to have the candid conversations around the LGBTI community, people living with HIV and other criminalized and marginalized groups. And I do hope that we will have people in the room who could speak to the issues, who could share the experience and lead the conversation. And I do appreciate that it's even the small things that Nerima raises as visas. You were invited for a meeting in Geneva and you're told the visa will not be ready until God knows when, while someone else would easily pick their passport and go to the meeting at Geneva. And I think those are some of the things that we fail to recognize. And that's why I go back to the point that if we're using health diplomacy, we need to go and look at this across board. So it would be my expectation that not only the US government, but other governments that want to decolonize health are actually looking and saying, are we making it harder by having our meetings in Geneva or having our meetings in Paris? And should we move them elsewhere where there are less barriers for people to travel? That would be one way to get more people on the table. And I think for me, the key point for me is that I don't want us to lose focus to the fact that there's always a risk when something is promoted. It's good the US government is driving the conversation on equity, but the danger we need to curb ourselves from that it shouldn't be something that people just want to do the tick the box. It should be something that is practically done to ensure the things I began with: impartiality, fairness, and justice. And I think on the side of communities and civil society, that is a role we will continue to play in terms of bringing evidence on the table and trying to hold both our national and global leaders to account on impartiality, fairness, and justice.
Thank you, Alan. And Pascal, the last word is yours.
Great. I guess if equity is important beyond the motherhood statements, then it needs to be unashamedly evident. And those in positions of power and privilege need to hold themselves accountable and be held accountable. And within the context of global health, if equity is of value, then it has to be valued fiscally and with the investments of the right tools and incentives to ensure the right outcomes. We can't continue to work with tools that are not fit for purpose. That's it.
Thank you. Thank you all very much for your visionary, strategic, timely comments. It's been amazing. I think I speak for all of us online when I say I've learned so much from the conversation. It's not only inspiring, but so helpful to hear from all of you. And I guess I want to underscore just in closing, the added importance of discussing health equity during this time of narrowing space for reproductive choice. And just to be clear, our institute is committed to being a space of urgent action on this issue. And this event we see as part of a whole series of convenings we're doing around health equity around the post-Roe legal and policy landscape. So please check out our YouTube for the events that we've done. And just to say, the first one we did with Loretta Ross, who just today was announced as a MacArthur Genius, on activism in a post-Roe world. We've done one on abortion provision, and we're about to do one on law and policy next week, which you see up on this slide. But really just to close by saying thank you everybody for your interest, for your commitment to addressing health equity. And please, as a number of us have said, please, those of us registered to vote in the US, please do. It's always important. It's never been more so. Thanks everyone and have a wonderful day.